Thank you very much, Mr. President. And Mr. President, I'd like to join you in welcoming our new member, Senator-elect Mike Knopfs, and we look forward to working with him. And I, however, rose for a different purpose in addition, which is to take objection to the action of the Senate last week, playing politics with the health of the people in this state. The QAP bill, as passed by the House, was very well intentioned. It was an attempt to retrieve $700 million of federal funding that are being left on the table in Washington because of our failure to provide state matching funds. It is very unfortunate that the bill was discharged from committee in a politically motivated procedural maneuver without allowing the committee process time to address some flaws in the bill. Some concerns about it that I had were the methods of calculating what physicians would owe in the QAP fee, and there was also a need to create a mechanism that would ensure reimbursement to physicians who paid into the fund. If we had been given time, we might have found a way to work out some of the problems with a bill. This is the purpose of a bill passing through two houses and their committee processes before it goes to the governor. It is very unfortunate that the Senate leadership chose to disregard the urgent need to properly fund Medicaid and instead forced a premature vote on this issue. A similar maneuver was involved with a discharge of Senate Bill 798 a few weeks ago in the middle of the night, a bill that was not ready for coming out on the floor. It was a bill I was one of two senators that supported, which would have raised the income tax rate, because I viewed spending $400 more a year for a family with an income of $100,000 an advantage over losing a $4,000 promised scholarship grant. But we weren't, again, given the opportunity to fully debate that option, and it was sprung upon us without preparation. In both cases, there was insufficient committee work to develop the legislation and allow members to deliberate on the complex policy issues involved. Now, Senate Majority Leaders and some in the press are construing these votes as Senate Democrats' lack of support for revenues to help address the severe fiscal crisis that Michigan is undergoing. This is misleading and false. Our Democratic leader has clearly articulated some of the possible revenue solutions that we could support. It is urgent that we address not only the underfunding of health care, but also public education, higher education, public safety, revenue sharing, and many other essential state programs. The governor and Senate Democrats have laid out detailed plans for ways that we can reduce tax expenditures by closing loopholes and eliminating outdated tax credits, enacting some targeted tax increases such as raising taxes on non-cigarette tobacco products and perhaps bottled water, perhaps raising fees by allowing establishments to have extended liquor licenses. There are a number of concrete solutions that have been put on the table. In my opinion, we also need to look at restructuring the sales tax to include a sales tax on services and amending the Constitution to enact a graduated income tax to have a more progressive tax system in the state. And we also need to revisit Proposal A, which is obviously underfunding our public education programs. But we will not have the tools we need to move Michigan forward as we reinvent our economy and reinvest in education and pursue other essential state government services and functions unless we take a serious look at these revenue options. So it is incumbent upon us to get down to some serious work, give up this political grandstanding that's been going on this floor, and roll up our sleeves and work in a bipartisan manner to find some serious solutions. And I'd like my remarks printed in the Journal. Thank you, Mr. President.